Hello, my name is Roxana. Today I will discuss childhood leukemia and its status as a public health issue. Here is the poster I did create with the information and research I have done the past couple months regarding childhood leukemia. Introduction, we will talk about childhood leukemia, some statistics and rates, some risk factors, interventions, and implications. An overview of childhood leukemia. Childhood leukemia is a cancer that affects the blood and bone marrow, specifically the bone marrow cells as they grow rapidly during different stages of development. About 30% of childhood cancers are leukemia, which mostly affects white blood cells, which are also found in the bone marrow, and they affect the immune system against infection. There are two common leukemias, acute lymphocytic leukemia and acute myeloid leukemia. Acute lymphocytic leukemia is abbreviated ALL, and acute myeloid leukemia is abbreviated AML. ALL counts for 3 out of 4 diagnoses of leukemia. There is no real cause for leukemia in children, but there are certain risk factors that have been researched to be related to its development. Genetics. If a child is born with Down syndrome, which is trisomy 21, or Li-Fraumeni syndrome, I think that's how you say it, that's a change in the TP53 gene. They are many times more likely to develop leukemia. The overall risk is 2 to 3%. And then also, if you have a sibling that already has leukemia, then that also plays a part in leukemia in children. Lifestyle. Women drinking during their pregnancy might increase the chances of childhood leukemia in their own child. There are environmental risks, exposure to radiation and certain other chemicals. Radiation on the fetus while in the womb is one example, treatment of chemotherapy from other cancers, certain drugs, and exposure to pesticides. And then here we have some statistics we did find with some of the websites that help generate that information. So incidence rate for childhood leukemia per every 100,000 compare between nationally, the US, state in Texas, and then in Dallas County. So this chart compares all three of those. Next to it, we have the US mortality rate by age at death from 2019 to 2023. And we can see the numbers are fairly the same, but it does seem that ages 1 to 4 is a little bit higher. And throughout doing this research, it does mention a lot that leukemia, any type of leukemia, is mostly very high at the ages between like 1 to 4, 2 to 5. So it just makes sense that that number will look high in a lot of these graphs. And then on top, we have the age specified incidence per age groups, which is from years 2016 to 2020 per 100,000, every 100,000. And so same, you see the number is high, closer to 10, every 10 per 100,000 in age group 1 to 4. And then we have leukemia incidence rates by age at diagnosis. We have the 2018, 2022, but this one compares boys and girls because also during this research, it does mention that boys are a little bit more prone to get leukemia, more higher rates in boys than in girls. And so you can see the blue line is a little bit higher than in the girls. And for both, it's obviously high in the age group of 1 to 4. And then we have leukemia incidence rates by age of diagnosis 2018 to 2022 per every 100,000, but comparing races, ethnicities. So as you can see, in all races and ethnicities, they are also high ranging in the age group of 1 to 4. But it was very interesting to see that non-Hispanic American Indian Alaskan Natives is actually the highest in that age group. So that was a very interesting thing for me. And then we have the intervention and target population. UT Southwestern, located in Dallas, and Dana-Farber Cancer Institute worked together to come up with four different interventions to target socioeconomic status and determinants of communities related to cancer. And so they have Pedicare, Pediatric Rise, Chef, and Assist. And then the Leukemia and Lymphoma Societies, they have the free booklets and videos, and then they have the Trish Green Back to School programs for children with cancer. This program offers free information and material to parents and educators. This program was developed to encourage communication among parents, young patients, healthcare professionals, and school personnel to assure children have a smooth transition going back to school. The booklets and videos are amazing. They even have stories to go with it. So it's pretty interesting to see the different things they have available for families with children with leukemia. And then there is one in Texas children, in the state of Texas. They have the Cancer Survivor Program or the long-term program. It monitors more than 2,000 patients for delayed side effects and complications caused by their previous cancer therapies. This program sees patients of any cancer diagnosis 2 years after the completion of therapy and 5 years from the first original date of diagnosis. The clinic sees patients who were treated at any pediatric center, cancer center. When an appointment is made, the attempt is to schedule all diagnostic and lab evaluations for the same day for convenience. The visit includes a comprehensive evaluation of patients' physical health as well as academic and social development. It also includes meeting with a social worker who can help assess coping skills, answer any financial questions and insurance concerns, and provide appropriate resources if needed. The long-term survivor program also provides basic patient education about the diagnosis, treatment, potential risks, and maintaining and maximizing good health in regard to diet, exercise, environmental exposure, and stress. The target population would obviously be parents or the guardians, families, and children who have been affected by leukemia from ages 0 to 19, and all the healthcare professionals involved to treat their diagnosis. Implications and stakeholders. Implications would include insurance access and then also working with the Childhood Cancer Star Act. So insurance is how treatments are covered because treatment is very expensive and insurance is a way to get as much coverage as possible. So insurance would be a helpful thing for families to have for their children in order to get the treatment they are needing and require because of the childhood leukemia they have gotten and were diagnosed with. That way it could alleviate some stress off of the parents or guardians' shoulders and they feel that can help their child. The Childhood Cancer Star Act helps advance childhood and adolescent and young adult cancer research while also enhancing childhood cancer surveillance and providing enhanced support for those who are survivors and those affected by childhood cancer. And then we have stakeholders that would include the health educators for the interventions, pediatricians and researchers, community health workers, and also the parents and children. Conclusion. Leukemia is a top cancer in children. There are different types of leukemia to look out for. There are different risk factors that can relate to its potential development and different signs and symptoms to look out for. So signs and symptoms, we didn't talk much about that, but it does include, they do say that there is no recommended testing to detect it before it even develops. Symptoms include tired, weak, pale skin, infections, easy bruising, frequent or severe nosebleeds, and bone joint pain. If any of these symptoms do show, it's best to take the child to their pediatrician. And then the help with the interventions and the necessary stakeholders, families and children with leukemia can have support and the necessary resources. I will add the link here. And then two discussion questions that I did think about while finishing up this presentation is when children are diagnosed with leukemia, in what ways can the new diagnosis affect them and their families' daily lives? The second one would be sometimes children do not fully realize what is going on with them when it comes to a diagnosis like leukemia. What ways can a doctor and or patients help children understand and explain to them what is going on with their health? Here's my references slide, and that's it. So thank you very much for taking your time. If you have any questions or concerns, feel free to contact me at my email at rtrejo1@leomel.tamuc.edu. Thank you very much.